Okay, so I'm going to be doing a continuous infusion. So I'm going to begin off by comparing my doctor's order to my MAR here. So this is for Bryson, Scotland, Finn, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9. That's all great. I have insulin, Humulin R. It's a continuous IV infusion, and my rate is going to be 2 units per hour, so that's great. I'm going to put my doctor's orders away, and I'm going to pull out my MAR here. So for my next check, I'm going to be grabbing my vial, which I have of my insulin here. I'm going to have my MAR and my PDM for my insulin regular, and I'm going to be turning this to the continuous infusion right here. So perfect. So for this, I'm going to be doing my first check, So this is for Bryson, Scotland, which we just confirmed with the doctor's orders. I have insulin R, so insulin, Humulin R, insulin, Humulin R. That's great. And this is here, insulin, Humulin R. So that's good. I have a dose of 2 units per hour, which I can get from this. So this is a concentration of 100 units per ml. So for my continuous infusion here, I'm going to need 1 ml to get my full 100 units to make my continuous bag, which is what I'm going to be doing and drawing out of this, which I can do so. So that's good. This is an IV medication, and this can be given IV. Also noting it's not expired, so that's great. And that's all good. And this is the right time of day to be giving it because the bag is empty. Okay, so that's all great. So now I'm going to review my PDM here. So I'm noting I can give this as a student nurse. It can be given IV continuous, so that's great. I'm also noting that this is a safe dose to be giving it over continuous infusion. It's 1 to 10 units per hour, so that's great. This is compatible with the normal saline mini bag I'm going to be putting in, as well as the carrier that I have running, which are both normal saline. That's great. There is the information, so I'm going to be able to put this into the IV continuous colleague guardian, and I can be putting it all in for a final concentration of 0.009 units per ml. That's great. I'm just going to be noting signs of hypoglycemia, so any sweating, blurred vision, kind of decreased LOC, anything like that, I will be monitoring and acting appropriately. And I will also be monitoring my patient's blood sugar every hour as per protocol to make sure that it is within a safe range. Okay, so that is all great. So now I'm going to draw up my medication here. I'm also noting here that my patient has no allergies as well. For 30 seconds, letting dry for 15. Okay, so for this I'm going to be drawing back 1 ml, which is going to give me my 100 units for my continuous here. Adjusting my air. And pulling back, making sure to maintain sterility.
Now what we're going to do is have everything to make sure that everything's good to go, and they're going to close time and label. So if they've done that, we can connect our label on our phone. So we're going to go into the patient.
I'm going to make
now. I'm going to bring my portless tubing. The reason why we're using portless tubing is because we don't want any interruptions of the
my 1 ml of my insulin. I'm going to write my label for that.
So what we're going to do is we're going to enter into the room.
And my volume is 1 ml, which gives me my dose of 100 units. 100 units, so I have my 1 ml giving me 100 units, which is what I need. So I'm going to pop that label on for my nurse to do her check, and that is all good. I'm also going to put my label on my mini bag, so I know that I need to be putting this into a 100 ml normal saline mini bag, so I filled out my label. I have the insulin R on it. Insulin R, that it's 100 units. I have my dose. My final volume is going to be 101 mLs because I'm putting my 1 ml into the 100 ml normal saline mini bag. My final concentration is 0.009 units per ml, date and time in my initial. So I'm just going to pop that onto the bag, so that is good. And I'm going to keep all this out, and I'm going to do my second check, and then I'm going to get a second nurse to do that also independent second check. So I'm going to be using my drawn up medication, my PDM, my vial, my MAR, and my mini bag that I will be putting medication into. So this is for, I'm just going to put the initials on here. So this is for Bryson, Scotland, Bryson, Scotland, Bryson, Scotland. I'm going to be giving insulin, Humulin R, insulin, Humulin R, insulin, Humulin R, insulin, Humulin R, insulin, Humulin R. So that is great. I have all of those, which is right. I'm going to be doing this continuous IV. So this can be given over a continuous infusion. I'm going to be doing that over my continuous infusion. This is optional for a continuous infusion, and this can be given over IV, and this also can be given IV. So that is great. My rate dose, I need to be giving 2 units per hour, which I have on this label here. To do that, I need to make my bag, so I'm going to be putting 100 units into this mini bag. As per my PDM, I'm going to be needing to put the 100 units, which is 1 ml, which is what I have here, giving me my 100 units. And this is 100 units per ml, so I know that 1 ml is going to give me my 100 units. So that is great. This is the correct time of day to be giving it because the bag is empty, and that is all good. Okay, so at this point I'm going to get my nurse to do a second check with this medication, make sure that it's all independent. She's doing it independently, and then it's all good, and then we are good. So I'm just going to actually have to grab my cordless tubing, so I'm going to bring all my medications with me. There's no medications being left.
So when I get my tubing and I have my label, so normally the orange
Okay, so I still have my medications, they were left, it's fine, and I have my portless tubing here. Okay, so that is all great. So at this point, I'm good to inject this into my mini bag. I'm going to swab for 30 seconds, let dry for 15, making sure not to touch it so that it remains sterile. I've done that check, and so is the second nurse, so I just need my 1 ml, giving me a final volume of 101 mLs. I'm going to inject that, and I'm going to put this into the sharps. I'm going to gently rotate to mix this, noting that the bag is not expired and that the integrity is good. So that is all good. We've done our second checks. Everything is good. I'm going to make sure to put this back into the med room, and everything is great. So I have my tubing, my label for my tubing, my medication, and I'm going to wash my hands and enter my patient's room. Hi, my name is Brianna Johnson. I'm going to be your student nurse today. I just have your medication here, this insulin for you. So we'll be giving you this insulin over a continuous time period so that we can better regulate your glucose, just because we haven't been able to manage it. So then we're also going to be checking your blood sugar every hour just to make sure that we're staying in a healthy range. We are kind of wanting to keep it within a certain parameter, so we're going to make sure we stay in that area. Do you have any questions? No? You're okay with receiving this medication? Great. So then right before we do, I'm going to do my third check, and then we'll begin, okay? So I'm going to take a look at my patient's armband here. So Bryson, Scotland, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9. Can you tell me your name? And can you tell me your birthday? Perfect. I'm just confirming you don't have any allergies. Awesome. I'm going to finish up my third check here, and then we'll be good to go. So I've done my patient. I'm noting that I have insulin R. This is a continuous IV medication. So this is going to be put into my colleague guardian there, and this can be given IV. It's an IV mini bag. And I'm going to be doing 2 units per hour. So to do 2 units per hour, which I have written here, I'm going to be needing to have the 100 units in my bag, which I did with my 1 ml. So that is great. This is the right time of day to be giving it because the bag is empty, and that is all good. Okay. So I'm going to, at this point, grab my portless tubing, which would be capped on both ends and not used before the bag would be closed. And just opening it so there would be caps on either ends.
13.5 ml volume of 250 ml. We're confirming that. And then we're going to put this into our pump. And then fish this in.
Okay. I'm going to
My label down.
spike my bag, making sure that we are all clamped, which we are. Turn it upside down. And then, as there would be a cap on this,
So before we connect to the patient, we're just going to have...
I'm just going to pretend that there is, so that this is still sterile.
To make sure that everything is correct.
We are going to
and
prime
make sure
this.
that all the setup is correct. I've already given my patient's education. We've also done our assessments with the APTT.
Noting that this tubing has been used before, so there is a little bit of extra medication in there. So in order to get rid of all the bubbles, I will have to get rid of some of the excess fluid in the tubing. Just because there are bubbles from when it was used before. I would normally try not to let any of the medication go wasted. But to get rid of those bubbles.
So now it's connected. Now we verify
Okay, so all the bubbles are gone. There is a cap on this, so I feel comfortable just hanging it here for a moment as it would be capped. I'm going to write the date and time, so March 13th and 2020.
And watch for the...
And I'm going to initial, and the time is
lower rate. I'm just going to stay for a little
11.
Watch for those 3 drops to ensure that it is running. And again, I'm just going to make sure that everything is on track to make sure that the medication will run through. Okay,
5 minutes.
Then we're going to sign our mark.
So
With the
I'm
date,
going
the
to
time, so it's 11:30.
get this set up into Colleague Guardian now.
3, and then the other nurse is also going to co-sign this. I'm also just going to make sure that I'm going to lock my pump.
Primary,
Kind of lock up. So normally we wouldn't state that out loud, but just for the
Primary,
purposes of demo,
Colleague
that's
Guardian,
what we'll be doing.
and I want insulin. Sorry. I would like insulin.
And we're watching for those 3 drops and see for those
Okay, so select. So comparing to my label here as well as my MAR, I know that my drug amount is going to be 100 units. That is what I do have here. So I have a final volume of 101 mLs, which is what I do have. That gives me the final concentration of 0.99 units per ml. That's great. So the dose that I'm going to be giving is 2 units per hour, 2 units per hour. That's the correct rate, the correct volume to be infused, and it has the label. So I'm going to confirm my primary.
when you
Set that aside.
it doesn't matter how many times you press your button.
I'm going to open up my pump.
So you don't have to worry about overdosing yourself. Only you should be pressing your release button when you should be pressing it. And you know that you receive the dose if you hear a beep sound coming from the pump. Okay, so the patient is now aware of how to use a PCE pump. And it's running properly here with the 2 green lights flashing. And I will come back in a few minutes to reassess our vital signs. And also, this can make your medication, this medication can cause you to feel kind of drowsy. So just let me know if you feel drowsy. I'll take your vital signs in a few minutes and do a pain assessment to make sure that the medication is effective for them, not causing them any adverse reactions. So before I leave, the other PCE button, they have a call-out button, the bed will be in closed position, and we also have the pump is running properly.
Okay, so that is all good. This is all primed. I'm going to grab my alcohol swab.
Then I'm going to leave the room.
And I'm noting that the Y site has already been primed. There is still a cap on this, I haven't taken it off yet. This has already been primed, so I only need to swipe it down, and then and then attach. So I'm going to do this for 30 seconds, let dry for 15. I would remove my cap off of my line here and attach. Now that this is stopped, I can unclamp, making sure that everything is unclamped here. I'm noting that I have the presence of a carrier because I wouldn't have a high enough volume to be infusing, so that's good. My IV site is looking healthy and it's patent and it's still running, so that's all good. My tubing is lined. I have also had my second nurse come in and do her independent check with this colleague guardian to make sure that everything's good, and she agrees that it's set properly. My patient is aware of what they're getting this for, and they have consented to receive it. So at this point, I am going to start. I'm going to be watching for my 3 drips, making sure that it is all infusing properly, and that's good. I am going to continue to monitor my patient's blood sugar, as we stated before, to make sure that everything is okay, and that's great. I'm going to make sure that the bed is in the lowest position, the call bell is within reach. My patient knows that I'm going to be continuing to monitor their vital signs and making sure that they're okay, and to let me know if they're starting to feel drowsy, sweaty, any of the signs of hypoglycemia. I'm going to document on my MAR with my second nurse that we gave this, that the bag was changed, the time, and then I will continue to monitor the blood sugar on the MAR as well. And I'm going to do my exit safety checks. My patient isn't in any distress. That bed is in the lowest position, and I'm good to go.